Time right now is 9:30 here on Live Impact News. I'm Jane Moniel. Thank you for watching every morning from 9 to 11, Monday to Friday. This morning, a new study raising some serious questions about where teenagers and young people are turning to when they're struggling mentally. We're talking AI chatbots. Nearly 1 in 5 teenagers or young adults say they're using artificial intelligence to deal with mental health and seek advice, and most of them are not telling anyone. Joining us this morning is someone who knows this space well. It's Jaron Doby from Novon Health. Jaron, always nice to have you.
Good morning. Thank you for having me.
Jaron, when you hear these numbers, 20% of young people using AI for mental health advice, as a therapist yourself, what is your gut reaction?
Uh, to be honest with you, it's one of those things where we know that AI is here. And it's something that is actively growing every day. Because when we say that 1 in 5 people, we really need to make sure that we're looking at the numbers according to that study from the Journal of American Medical Association. That's about 8.2 million young people. And when we say young people, we mean between the ages roughly of 12 to 21. So that is definitely a large number, and it's growing every day.
Yeah, what do you think is driving this kind of growth then towards AI?
To be honest with you, AI is meeting a need. Young people can access it 24 hours a day. It's free, it's immediate. There's no fear of being judged. If someone's struggling at 2 a.m., they can open an app and start talking instantly. For many young people, that's easier than telling a parent, telling a friend, or a therapist how it is that they're feeling, because AI doesn't have office hours and emotional pain doesn't either.
Yeah, I mean, it definitely makes sense. Over 90% of teens who use AI say that it is helpful. From a clinical standpoint, how do you interpret that?
Well, before I get to the benefits, I want to say that also we have to make sure that we're acknowledging that many communities still face barriers to mental health care, and AI is filling that gap. Long wait lists, cost, transportation, and stigma all make AI feel like that it's the easier option. But when it does come down to benefits, I think that two things can be true. AI can be helpful, but it should not be viewed as a replacement for human connection or professional mental health care, right? It can help you organize your thoughts or learn coping skills, practice self-reflection, and access information, of course, immediately. But in relation to the limitations, AI doesn't truly understand human suffering. It doesn't know your history, your body language, the trauma you've experienced, family dynamics, or even the risk level. The way that a trained professional like myself can make sure that we obviously can recognize.
Yeah, I mean, and obviously that could be a dangerous thing, right? Not being able to see the distress in a young person when it comes to communicating, I using in quotation marks, with AI. And and so what do you tell young people when they're finding it helpful, but they're not getting exactly the full benefit of talking to a real person?
Right. We have to remember this, that AI can be the bridge to support, but it should never become the destination overall, of course. Like, this is something that can provide information, but healing still happens in real relationships. So we have to make sure that we are interacting with folks. Because according to that study that you may mention to Jane at the beginning, that I've been referencing as well, the biggest concern out of all of that is that these young people are not telling anyone that they are using this, right? So they're normalizing not interacting with other people, but going straight to an AI chat related source in order to be able to share their transgressions, right? In order to be able to get some assistance. And that's the concerning part.
Yeah, I mean, so if we don't know, people are not telling us because they're choosing to remain silent.
Mhm,
One, what is driving that silence then? And two,
mhm.
how do you open up to someone?
Right. That's a really good question. What drives the silence is very much so it can be contingent on the person. If I don't have the best relationship with my supports in my life, right, that could drive me to it. If I don't feel comfortable, right, engaging with other people the way that others may, that may drive it as well. I may feel like that I don't have supports at all, but also we're talking about the convenience, right? If it's really late at night, or if I'm away from home, or no one's around, or no one's available, and I have something, right, that I can immediately in the palm of my hand seek some type of information or comfort from, then that's something that folks are going to use. So we we have to make sure that we're mindful of that, but we also have to make sure that we're mindful of the information that is shared. Look, that it's pulling from information that is publicly available to folks. But once again, a trained professional, right, is able to be able to recognize suffering, other symptoms, and be able to use other scales measuring tools in order to make sure that we can truly identify if a person is okay or needs further assistance. So we have to be mindful of that.
You touched on it earlier here about disparity and having access, especially, in certain races, data showing that black youth are more than 5 times more likely than white people, it says, to use AI chatbots. What is the disparity there? Why is that happening?
In relation to using the chatbots more, I would say that clearly because of those disparities, right? If in minority communities, if services are not available to folks, right, then I have to use what it is that is available to me. With the boom of AI, that allows me to be able to access some level of information in order to be able to help me, right? So this is something that we all have to bond together on in order to make sure that we address, right? Because being able to have
Did we just lose them? Did we just lose
a
them?
lapse or an absence or a gap, recognizing that there are gaps, that there are needs in minority communities and different communities, of course, to make sure that we are making sure that we're extending services to those that are in need, because mental health care is so important. To be quite honest with you, we have to make sure that, again, and I can't say it enough, that we are bonding together to make sure that we're filling the gaps.
Yeah, it takes a village. So, as a therapist, talking to a parent who may have just found out that their child or teenager or young adult is talking to AI when it comes to mental health and turning to them as opposed to their parents and having a conversation so deep like this, what do you say to them and how do we walk alongside with AI and young people?
Right. So one of the biggest mistakes is folks trying to be fixers at the end of the day. Instead, I want to encourage family members and supports to focus on just being present. One of the things that you can say is, notice you haven't seemed like yourself lately. How are you really doing? Right? You don't have to go through this alone. I'm here to listen. The goal is not to have the perfect words, Jane, right? The goal is to create a safe space where someone feels comfortable being able to open up, right? People don't need perfect conversations. They need safe conversations, right? Connection is still one of the most powerful mental health interventions that we can have. So just being willing to be present, just being willing to ask those open questions, right, to allow a person to disclose that, or be able to make sure that we are fully aware of how a person prefers to communicate and making sure that we're utilizing that to our advantage.
So I'm hearing that we can use AI as a tool, but certainly you need the whole package. Is that the
Yeah,
takeaway?
the danger isn't using AI. The danger is using AI by itself. You have to make sure that we're making sure that we're utilizing human connection and professional help and not simply relying on AI. That is where the danger comes in.
All right, Jaron Doby. I mean, doctors, parents, educators, schools,
Yes.
something that we could all take a little bit of from our conversation today. Appreciate that.
Thank you so much for having me.